So I am going to say good morning again and welcome to the Children's Oral Health Coalition's session 2 of Train the Trainer Growing Cavity-Free Kids. Yes, that's what we've always wanted was for kids to be cavity free. Um, I'm going to go through the little disclosure slides like I did yesterday. So sign in. We've already talked about that. Stacy will throughout the training for anybody that signs in later, they'll still have access to the link um, to sign in because that is how you'll get your certificate. From a disclosure standpoint, Dr. Fuqua nor myself have any relevant financial relationships to disclose. The photo video disclosure. Okay, well, I guess we're pretty much covered with that one, but your audio, your name will show up. So if you want to change out your name, rename yourself, you're more than welcome to do that because we are taping the sessions. Okay, that's better. Well, Zoom etiquette. Don't worry about the video. We don't have one today either. Audio, I'm going to ask everybody if you're not muted to mute yourself. And again, guys, I'm going to stress, we really do want you engaged and active. This session has so much activity in it and you really get out what you put in. And with this being virtual, we're trying to pull it out of you. So don't be afraid to ask your questions as we go through the different pieces. If you have a question, just unmute yourself or raise your hand. Dr. Fuqua or Stacy will see that and will be able to um, call on you or get Stacy will be able to get Dr. Fuqua's attention so we can at least get your question answered. Feel free to drop it in the chat box as well because that way we can kind of stop to answer those questions. So please, please don't hesitate to ask your questions. We want to get them answered for you. So what we're going to do today after this training, we're going to demonstrate effective brushing and flossing techniques. And yes, there are some actual techniques and some right ways to do the brushing and the flossing. And it's primarily because we don't want you to hurt your gums or your teeth in the midst of when you're brushing and flossing. We will also talk about the importance of having a dental home and tips for dental visits for those first-time babies especially, and identify healthy foods and drinks. That is going to be so much fun. I wanted to kind of talk about here before we started the quiz, just some overviews of some of the things that we got from yesterday, but we kind of did that through our little registration period earlier, which I thought was really good, guys. Hearing the feedback about the increase in knowledge around catching a cavity and that it could spread, understanding better the infections throughout the body from what's happening in your mouth once you get that abscess tooth and that infection spreads to different areas of the body, and how what you eat and what's happening in your mouth it can affect the other diseases that goes on like heart and diabetes and a few other things, and even how much it affects the baby's teeth even before they get their teeth in utero. So those were good things to hear because those are important things when you're sharing them with other people for them to really understand what some of that looks like. So I'm so glad that we did accomplish our goal for yesterday, and I'm really looking forward to accomplishing that goal for today as well. So I always like to start these with a little bit of a quiz to have some fun. And the question today is, when brushing your teeth 2 times a day for 2 minutes, you can skip the dental visit. True or false? And you're going to have to unmute yourself to answer.
False.
False.
Boss.
Why is it false? It is false, but tell me why you tell me why you think it's false.
Because our children are growing and changes can occur if we stay on top of
Yep, that's
the
a good
bad
answer.
changes. Then the treatment is going to be probably lesser, less stressful for the child too,
Yeah.
and they'll have a better health outcome.
Absolutely. And going to the dentist, that's why that is so important to not skip those dental visits is because that dentist will see something that you can't see with your naked eye when you're doing the x-rays and that type of thing. And it's just good to have those regular dental visits to keep the kid and yourself healthy. On to the
Yeah,
next one.
yeah.
Question number 2. To clean back teeth, you need a large head toothbrush.
Soft and small toothbrushes are the best.
Yes, it is. And I'm not going to steal Dr. Fuquay's thunder, but that is also, you were right, it's false. And question number 3. Parent supervision is no longer needed once the child can hold a toothbrush because they know what they're doing. True or
False.
false? It
False.
is
False.
false. Do you know why it's false?
Because they still want, probably, even though they still won't do it for the a lot of the time, and they probably won't do it right.
Clarabella, are you thinking about your son?
I'm telling you, you know where I'm going with this.
Or they turn the water on and splash it with their fingers under there.
Yes. And when you think about especially the young ones, they still don't have the dexterity in their hands to brush their teeth really well. So you really want to make sure that supervision is there until they are doing a proper job. So good job, guys. Y'all know the answers. Y'all are already off to a good start. So Dr. Fuquay, that may make your challenge a little harder because these ladies are ready to go.
Well,
Doc-
I love that. That is not a problem. Maybe I'll learn something from the attendees today. So thank you again for joining us for round 2, session 2 of oral health, and really learning how we all can take care of our own teeth, but as well as help start a child on the right path before they're even born. Um, so as a quick reminder, just in case anyone is on today that maybe was not able to be on yesterday, I'm Dr. Tanya Fuquay, and I am the Director of Child Oral Health here at Cook Children's under the Center for Children's Health. So I get to work with the Children's Oral Health Coalition as well as Save a Smile. And I get to work closely with our Renaissance Dental Clinic, the one and only dental clinic for Cook Children's. I'm also in private practice, so I'm not just in an administrative role. And everything that I go over today is what I talk about with our patients all the time. So don't feel like, oh my gosh, maybe I should have known this stuff. No, like I mentioned yesterday, we're not here to make y'all a dentist. And that is the dentist job, and our hygienists that are in our office. It's our job to teach our patients, to teach our parents how to take care of their child's teeth. They didn't go to dental school, we did. So it's our responsibility. But we got to make sure that people understand they need to see a dentist at least twice a year for checkups and cleanings. So let me just kind of review and remind everybody. So yesterday we learned the importance of oral health during pregnancy, after the baby arrives, and then we learned about the importance of the oral health for that infant before they even have teeth, and why is it even important to start that early. That's what we did yesterday. Well, today we're going to go over details on how to use the tools that we need to use to keep care of our teeth. Parents and caregivers responsibility, hello, if I can get my words out this morning, responsibility for brushing and taking care of their toddler's teeth. One of the questions that Elaine already asked to start you off with, which you all answered correctly, so I'm so proud. Um, Parents really need to be supervising their child in while they're brushing their teeth, but be a good role model. Like we talked about yesterday, parents are the role model. They're the first ones that kids see doing things, and so you want to set a good example. So parents should really do what they're asking their children to do, right? And then if they do that, man, everyone's going to be healthy in the family. So I want to say that one thing though, as we're talking about young children, and in Elaine's question, that once kids know how to hold a toothbrush, they're good. They're all on their own. Well, no. However, children become little independent people. And when they're 2 and 3 years old, they stomp their feet and they want to do it themselves. Don't squish that. Don't tell a child they can't brush their teeth on their own. Let them, allow them to. If they're not engaged and part of the process, you're never going to get them going that direction. So make sure that when you're talking to parents, or you as a parent, let your little child brush with their own toothbrush, but then you as the parent follow up with that child to make sure that they are doing a good job. Okay. So I just, we tell parents they need to be really engaged and a part of things, but at the same time, we need to allow our children to get their independence and have fun with it. They need to learn. And as they grow older, they'll become better. They'll do it well. They'll have a little more attention to detail, but still parents are responsible for that, and caregivers. Children are just not physically capable, and they don't have that attention span to do it properly. So parents should continue to supervise their children all the way to age 8 or 9. Really, the American Academy of Pediatric Dentistry really kind of stands strong on the 9. And by then, kids are definitely thinking they can do everything on their own. I always find it funny, but I love to hear it when parents say, I asked my kid to go brush. I didn't watch them, but then I went back in there to see if their toothbrush was wet. I love when I hear that, because our parents are being little investigators and they're checking out. And it shows that that parent was trying to allow their child their independence, right? They asked them to go brush. They're seeing if they're doing that. And then that's a teachable moment, right? To make sure that they do get in there and brush their teeth. So parents should choose a toothbrush for a child that's going to be appropriate for that child's sized mouth. But I will say this pertains to everybody. I want to make sure that we talk about the fact that children obviously have a smaller mouth. Hello, their mouth is smaller than an adult's. However, there are adults, teenagers and full-grown adults that have a very small mouth. And so the size of the head of the toothbrush is going to be very important. I don't know if I'm going to be able to display this. And go back to the previous slide, please. I'm not sure exactly if y'all can see this, but this toothbrush, which is the big, large toothbrush for our little mannequins, I mean, it covers my whole mouth. How am I going to get this huge thing into my mouth to do a good job? So I would actually lean more, if someone was trying to choose a toothbrush, choose a smaller headed toothbrush to make sure you can access and get everywhere in your mouth. A toothbrush should be replaced every 3 months, or if a child has been sick, or you as an adult. If you've been sick, wait a couple of days, especially if it's a type of illness that is going to require an antibiotic. You would want to wait 3 days of that sickness. Once the 3-day mark hits, throw that toothbrush away, because now you're starting the healing process. Okay, so make sure that that you're paying attention. I love some of our pediatricians here at Cook Children's, it's not all, I'm sad to say, but hopefully we'll get them there. But for sure, our urgent cares, if they come in and they diagnose a child with strep throat, right, or some sort of infection that's going to pertain with their mouth, they'll tell them and hand them their own toothbrush, so that they can replace it after a few days. When choosing the right toothbrush, you're not only looking at the size of the head, but you're also looking at the handle. You're also looking at the shape of the toothbrush. And you're wanting to see the soft bristles. So most importantly, you're looking at the size. Does it say child, infant, adult? What does the size on the toothbrush say? So that could go for age appropriate. Small headed toothbrushes, soft bristled toothbrushes, all the big important factors to think of when you're trying to choose the appropriate toothbrush for whether it's yourself or your child. So make sure that those are all things that you look at. And I will say, people ask me all the time, well, why do they even make hard toothbrushes if all dentists are saying to use soft? Well, why do they make cigarettes? Why do they make alcohol? When used in consumption, if people are asking for it, they're going to make it because it's a money-making machine, right? But the appropriate type of toothbrush is a soft bristled toothbrush. They even make ones that say extra soft, even better. The harder the bristles doesn't mean, ooh, the more I'm going to get off, the better the cleaning job's going to be. No, and you'll learn the technique in a little bit, but soft bristled toothbrush, this will help to not damage the teeth or gum tissues. I'm going to head this over with Elaine because we're going to do a little activity.
Unmute myself. Thank you, Dr. Fuqua. And so guys, in your packet that I sent you, you had a right size toothbrush activity, and you also had a right toothbrush size chart. So I don't know if you printed those out or not, but those are the tools that you need to use. So we're going to go through and let me just share this. And when we do these presentations live, it's actually an activity that we do at the table, and you match up the toothbrush with the age group of the child that Dr. Fuqua just shared with you. So now we're going to do that but we're going to do it as a group. So if everybody understands that, let me hear you drop something in the chat box, or let me unmute yourself and let me hear you.
Yes.
Okay, thank you, Ms.
Yes,
Cassandra.
got it.
Yes.
Yes.
Okay, awesome. Okay, so because now that I'm looking at this, I probably should have put the ones with the numbers on them to go over with you since we switched it. Do you have them in front of you,
Yes.
your handout?
Yes.
Okay,
Yes.
Yes.
okay. So on toothbrush number 1, what group would you put that with? The toddler, the youth, or the older teen?
The toddler.
I'd say toddler.
Okay,
Nope.
and
Looking at it, probably the youth.
okay, I was going to say, why would you say toddler?
Looking at the head of it, I'll say the youth.
Yes. Okay. I'm saying yes to that. I'm hearing you say that for the youth, right?
Yes.
And that would actually be correct. That is a youth brush. So how about brush number 3, which is the little that's on top of the Crayola brush?
I'd say toddler.
Toddler. Toddler.
Okay. Very good. It is a toddler. So what about brush number 13? It's the yellow one. That's the pink one's on top of it, but it's the yellow one underneath.
I'd say youth.
And why would you say that, Clarabella?
The head of the brush is a little bit larger than the toddler one.
Mm-hmm. And what about the handle?
the handle is it's not really, it's less bulkier than the toddler one. That's how I
Okay,
describe
so you would put it with the youth?
it. Yes.
Okay. Can I tell you something? That's
Mm,
absolutely right. But in the live training when we do it, that is the toothbrush that stumps everybody
mm,
because they look at the handle and the handle is short. And we tell you
mhm,
shorter handles
Mhm.
for the toddlers, right?
mhm,
So that
Right.
handle is short, but you're right. When you look at that head, the head doesn't fit the mouth or the
mhm,
age of the child. So
mhm.
kudos, girl. You got that right off the bat. That is usually the one everybody puts it with the toddlers. So very good. So what about brush number 10 right next to that yellow one, the blue brush?
Uh, I would, I don't know.
And somebody else can
It-
share. Don't make sure Clarabella do all the work.
That's why I'm not saying anything.
I would say youth because of the head. The handle is a little bit, I guess, more ergonomic, but the head is a little bit big for a toddler from what I'm seeing in the picture.
Hmm. So,
So
anybody
I
else?
would say youth.
Okay, so you would say youth. Anybody else before I answer?
I would say youth or adult
And why would you say youth or adult? Pick one.
because that's what I would use.
Well,
Yeah.
so now let me just share with you. The blue one is actually an adult toothbrush.
See?
But you were right to look at the head. So now when we think about the youth in that age group of 6 to 9, you all know we got some kids that in that age group that look older than what they're taller, they're bigger. So
True.
that's why you also look at the mouth size of the kid. So I will
Mhm,
say that, right?
mhm.
But that is an adult toothbrush. And then the toothbrush that's, oh, I forgot I had this. When you look at this one, I'm just going to tell you, looking at that handle, that's a youth brush. And you're looking at the head. The head here tricks you a little bit because it would fit a young toddler's mouth. So having said all of that to you, when you're shopping for toothbrushes at the grocery store, they're going to give you an age range for that toothbrush. They no longer give you a toothbrush exactly for a 2-year-old or a 4-year-old. It'll be maybe an age range of 2 to 5. It may be even a age range of 2 to 8. So when you're looking at those age ranges, you're going to have to also look at everything we're talking to you about here, the shape of that head, the length of that handle, is it fat for those little hands to hold on to better? Or, like this one has a good little head, but that still may be too long for a toddler. Depending on your toddler and what they're able to do, you have to consider that. But this is more ideal because again, that brush, that handle too long, if they go back to those back teeth, they're going to injure themselves. And we don't want that happening. So that's just a fun little exercise that we do to kind of open your eyes. But the biggest takeaway from this is the size of the head, the length of the handle, and keeping in mind the age of the child and making sure that it is a soft bristle brush that you're using. And when you're looking at that at the grocery store and it's those age ranges, what about that brush fits with the age of my child? That is what you want to keep in mind. Okay. Thank y'all for participating. Okay, Dr. Fuquay, I give it back to you.
All right, good deal. Thank you. Good exercises. Just kind of really an opportunity to just make you think, and it makes you stop and look at things in a different way, right? The same kind of thing, looking at, like we talked yesterday about going to the grocery store and looking at the ingredients in something, right? To kind of know. You have to be informed to understand what toothbrush, because when you do go to the grocery store, the drugstore, there's so many options, you know? So you kind of try to have to look at all that information to really truly get the appropriate or best toothbrush for you or your child. So we learned about the actual toothbrush itself. Well, what are we supposed to be putting on toothbrushes? Toothpaste. So let's talk about the right amount of toothpaste and what type of toothpaste to use and when. So not only is it important for the right size toothbrush, but it's also important for the right amount of toothpaste. It used to be, for the longest time, was use a pea size amount. So you see in the picture on the right, the little pea kind of gives you a concept of what that looks like. Well, in the most recent years, the American Academy of Pediatric Dentistry and the American Dental Association, worked together to say that actually children 6 months of age to 3 years of age should be using a rice size amount. So that's the picture you see on the left. The reason for that is because at this age time, they're not usually coordinated enough to hold that toothpaste in their mouth and then spit it out. So we want to make sure that there's a little bit of something on there to get the child used to brushing with something or flavor or a texture there. And like we talked yesterday, if it isn't a child 6 months of age to 2 years old, we really want them using the training toothpaste. It's AF that has no fluoride in it. Remember, that's the gel that we talked about. But the 2 years old and above, they can start using the regular toothpaste, children's toothpaste that will have some fluoride in it. But again, they're going to use the rice size amount until age 3, and then after that, a pea size amount. It's important to start trying to get your child to spit out. And unfortunately, I heard someone say earlier about water going everywhere. Yes, this whole toothbrushing process with children is typically a little messy in your bathroom. Water's getting everywhere or toothpaste is getting everywhere. And just monitor your child, because when they get that 2 to 3 years of age and want to do everything, darn it, themselves, they're going to want to squirt the toothpaste on there. So still continue to monitor the amount of the toothpaste that is going on there. The other thing about the toothpaste, while we're talking about the right amount of it, well, the right toothpaste for a child, again, the gel-like when they're infants and smaller, so that they can learn and feel a texture in their mouth. But at the same time, you got to be careful with what type of toothpaste, because something that tastes nice and minty fresh to you and I is going to taste spicy to a child. So, and this is a difficult thing to really review and stress with our families, from low income families, families that are struggling financially, just to keep food on the table. They try to buy one tube of toothpaste and have everybody use it. But unfortunately, we're not going to set up these little ones for a good dental patient if they're not brushing with something that is not appropriate for them. If it's too spicy, they're not going to want to do it. And then you're going to lose them into those good brushing habits just because of the spiciness. So the size and head and all that of the toothbrush, the size and amount of the toothpaste that is used, what type with the training or the one with some fluoride, the age groups of when to do that. So lots of rules here, lots of things to think about when you're brushing. It's not just pick up a brush and start brushing. I mean, there are things to think about to get the best results, okay? Brushing and doing things, even if it's a little bit off of what we're asking, what we're reviewing today are best practices. This is the best way to do this, to take care of your teeth, to have the best results for your child. A thing that we like to say a lot is, it's one of my favorite things that I came up with years ago, and I think it's an easy way for people, for children even, to remember, is our rules of two. Now, the American Dental Association kind of came out with this rules of twos years ago, and I was already talking this way, and I already was going one step further. But the rules of two are: brush your teeth 2 times a day for 2 minutes. So like I mentioned yesterday, brushing your teeth every morning and brushing your teeth every night before going to bed. The very last thing you do before you go to bed, brush your teeth, and then do not eat or drink after that. Drinking water is fine, as long as that's drinking water before maybe a child was to start swishing with fluoride at a little bit older age, like 5 or 6. So the rules of two are really good, not only for this brush your teeth before the kid goes off to school. Best practice is to do it after they've eaten their breakfast. But I completely understand, we are such a mobile society. It's get and hand your kid something to eat while you're driving them to school, right? Or something like that. But the best practice is to really let your child eat their breakfast, then brush their teeth, then you go off to school with clean teeth, right? Or you start your day with clean teeth. But not only do you need to brush 2 times a day, but you need to brush for 2 minutes. Doesn't sound like very long, but guys, put a timer on and think about it. 2 minutes actually is a long time. 1 minute for the top teeth, 1 minute for the bottom. Now, the other rule of two that I like to say is seeing a dentist. What do we say? Twice a year. So rules of two with 3 things: brush your teeth 2 times a day, brush for 2 minutes, and that's for all of us to brush 2 minutes, and to see your dentist twice a year. Now, some adults will be asked to see a dentist. The dentist will ask for a little longer time to see them more often, maybe every 3 months, every 4 months. Maybe when a child gets into braces, we definitely recommend every 3 months, because we as dentists want to protect your investment of your child's teeth with those braces, which are not cheap. I think there was a question, so I'm going to let Stacy ask me this. So the question was asking about, is there a better toothpaste than something else to use or whatever? My answer to that is the training toothpaste from 6 months to 2 years of age, a children's toothpaste after age 2, and then adults going to a toothpaste that has a tartar control factor in it is usually the best. General recommendations. Brands, I'm not specifically here to say which brand, because every brand has a different flavor to it, and that resonates, or a different texture, pasty, gel-like. Everyone likes the feel of something different. Everyone likes the feel of those different toothpastes. So I'm not here to say use Crest or use Colgate or use what. If it's ADA approved, you look at the package and it has the American Dental Association's seal of approval. It's been through testing. And it basically, what they're sealing with the approval is this toothpaste does what it says it's supposed to do and fits all the criteria that dentists would want to recommend. So if you see the ADA seal of approval and you're using the appropriate type for the certain ages, then I am all for that. I will give a disclaimer here though. There are so many toothpastes out there for whitening, for having baking soda in it, things like that. I will tell you that the whitening toothpaste don't do a great job of whitening your teeth all on their own. But what the research has shown is if you have professionally whitened your teeth, and of course, this is going off topic with children, but so many people ask this because there's so many different types of toothpaste out there. The whitening toothpaste will help if somebody's professionally whitened their teeth and they would like to keep those results for a period of time. The whitening toothpaste will help maintain that. okay? And as far as the baking soda, I do not recommend using the baking soda toothpaste all the time. Any toothpaste has baking soda, which in the old days, if anybody talks to their grandparents, that's all they used to brush with is baking soda. Put a little water in with baking soda and they brush their teeth. Baking soda is great and it does help with some staining, but to use it every day, baking soda is very abrasive. It's almost sand-like, where it really can damage the enamel of the teeth if that's all you use day after day after day. If you want to use that a couple of times a week because you just feel better, you feel like your mouth tastes better, feels cleaner, I'm all for that, but not for every day, twice a day. All right, we can move on. Let's talk about, you're most welcome, Clarabella. Hope that answered that question. So the next slide, we're gonna start talking about the technical part of how to brush. Like I mentioned yesterday, there is a right and wrong way to do it. So you're gonna see here in the box, in the little boxes there, which they're labeled the 1, 2, and 3. And then I'm going to demonstrate in just a minute, but let's visualize this a little. So when you're looking at slide number 1, this is where we're talking about you need to angle the toothbrush at quote a 45-degree angle. Now, adults and teenagers, we can say 45-degree angle and they get that. Little ones, you can't tell them 45-degree angle and they're going to do that, okay? The important part with the little ones is doing a circular motion. So let's talk about the angle. The best practice is to angle the toothbrush at a 45-degree angle because that gets the bristles in the right direction to brush the entire tooth surface, all the way to the gum line. You see in the picture too, where the toothbrush is now going to the sides where it faces your lip and or your cheek, that side, okay? Picture number 3 is getting the angle, 45-degree angle, now brushing on the tongue side of the lower teeth, or if it was upper, the palate. Slide number 4, there's 2 pictures on there. You're gonna see that, again, the head, the bristle, the head of the toothbrush, this is another area of importance because when you feel on your lower teeth especially, the width of this, your angle of your mandible, your lower jaw or your upper jaw might be more bird beak instead of rounded. I'm talking rounded or bird beak, okay? If you're bird beak, what does that come? I'm coming to a point. So guess what? This head of the toothbrush can't get to that pointy area because it's too pointy. It needs to be more rounded. So the smaller toothbrush is always better for those cases, but also angling that toothbrush where you turn the toothbrush this way to do the lower instead of the horizontal wise, right? So if you're real pointed in the front of your jaw or your child is, then you want to change the angulation of the toothbrush to get that area, okay? Number 5 is showing the chewing surfaces of the teeth. That's where all our grooves are. That is where all the food likes to stick the most, right? Because it's groovy. And I can't tell you, I know everybody does. We all get food kind of stuck in those grooves. That is the only area that you can scrub back and forth is the chewing surfaces of the teeth where you have those grooves and what you do to bite with your teeth. That is where you can go back and forth. Everywhere else that you see the toothbrush going on the front side of your top teeth or bottom or the inside, that is going to be at a 45-degree angle and in circles. So I'm going to show you, I'm going to stand up so I'm not, and I'm hoping that you can kind of see this. There's the 45-degree angle. If you were to go flat, you're missing up here by the gum line. So if you could practice this at home and look at yourself in the mirror, putting your toothbrush flat, okay, means perpendicular flat, or the 45-degree angle. The 45-degree angle, again, gets the whole tooth all the way to the gum line, okay? And then what did I say? Little circles, little circles, little circles, little circles. Okay, that should be done. And the reason you're angling towards the gum is because you want to get the whole tooth. The whole reason you're doing little circles is to not damage the teeth. Okay, I mean, damage the gums around the teeth. So if you're put it flat and you're scrubbing back and forth, guess what you're doing? Those little peaks of gum tissue, the little peaks of gum tissue in between that, you're going to damage the gum tissue. You're going to lose gum support around the teeth. This is where the name comes in. I've got receding gum line. And people think, oh, I'm getting older, I'm getting receding gum line. No, it's you're brushing your gums away. There is nothing that causes the gums to recede or to start showing root exposure. Only thing that does that is the improper use of a toothbrush. Who would have thought you got the right size, the right head, the soft bristles, but you can still damage your teeth. So make sure that 45-degree angle, okay, is in there and you're going in little circles. On the chewing surface, what did I say? You can scrub back and forth. You gotta kind of scrub back and forth of those chewing surfaces because what? It's hard to get in those grooves and cricks and cracks. You've got to really get in there and brush back and forth with the toothbrush, okay? And the last thing to brush in your mouth is that tongue. You've got to make sure we clean that shaggy carpet, okay? That is a great place for bacteria to hide. The tongue is covered with papilla, and that's why I call it a shaggy carpet, because if you were to look at your tongue underneath a microscope, it looks like a shaggy carpet. So you really have to get in there and brush it. Your mouth is not clean or complete until the tongue is brushed. And you should brush your tongue every single time you brush your teeth. I believe I saw maybe a question come through on here. So, okay, so remember what I just talked about by putting it flat and straight? If you're putting your toothbrush flat, or even if you're angling a 45-degree angle, but you're scrubbing back and forth instead of the little circular motion, and it's a hard bristled toothbrush, you're going to do more damage. Because you can do damage with a soft bristled toothbrush, not holding it at the right angle and scrubbing back and forth. So what do you think you're going to do with a hard bristled toothbrush? That's kind of like you getting your SOS pad on a type of pan that you're not supposed to use that on. You're going to scratch it all up. And that's exactly the best way I can describe why you would not want to use the hard bristled brush, is because, and people tell me, I have patients tell me all the time, I tried that toothbrush you gave me, Dr. Fuquay. I just don't feel like my teeth are getting clean. Then I start talking to them. I said, okay, well, then show me how you're brushing. And I mean, 9.9 times out of 10, they're not brushing correctly. And that's why that soft bristled toothbrush doesn't feel like it's doing its job, right? Not because it's soft bristled, but because they're not doing the right motion. Okay, so great question. And now you hopefully understand a little bit more of why the toothbrushing, there's the right and wrong way to do it. And it's with all of us. And it makes me sad when I hear patients come in, I'm seeing them for the first time, and I tell the mom, you know, hey, or the dad, whoever it is, that they've got receding gum, the gum tissue, and I start showing them and explaining why. And they're in their 30s, 40s. And it's the first time I've ever seen them. And they say, why has no one explained that to me before? I've gone to the dentist my whole life. That's why I have to bite my tongue and make sure I don't say anything ugly. But I want to say, you know, I just tell them, well, you're here now, and I'm here to teach you how to do it. My hygienists take the time to make sure people know how to do it. So I will say that it disheartens me to hear that not all dental offices or practices stop and take the time. I never want to assume that a 20-year-old, a 30-year-old, a 40-year-old, just because they're 40 or 30 and they say they've been to the dentist, I can't assume that anyone took the time to stop and show them how to do it appropriately or how to use the right one. And I hear it over and over with our hygienists, with our assistants, and hearing it from my own 2 ears, patients saying, oh my gosh, I wish I would have known this earlier. Okay. So sometimes, like everybody else in this world, we get so busy and so caught up in our daily work that sometimes we forget to stop and go to the basics, right? Let's stop and talk about the basics. So I'm here to say, I think the rules of two, I hope will continue to resonate in your head, that I need to brush 2 times a day. I need to brush for 2 minutes, 1 minute on top, 1 minute on bottom, and I need to make sure that I'm seeing the dentist twice a year. I'm brushing my tongue, get all that bacteria that's hiding in my tongue, get it out of there. All those things will hopefully help you remember about those rules of two. Now, I'll just bring this up myself. Some people asked yesterday, or someone asked yesterday about the water pick. The same concept here with the electric toothbrush or the battery operated toothbrushes that are out there at the grocery stores and drugstores for children. I don't sit here and say you have to. That's the only way you're going to get clean teeth. No, because that's not true. You can do, if you do everything that I just mentioned with a manual, regular handheld toothbrush, you're going to do an awesome job. You just got to do the technique that we talked about. Having an electric toothbrush, though, reminder, just because it's moving and it's rotating, if you're not holding it in the right angle and getting it to the areas it needs to get to, it's still not an effective toothbrush. It may be doing the movement, but it's not, you're not getting the bristles everywhere on your tooth. If you're not angling it at a 45-degree angle and you're not making sure that it's touching the whole tooth all the way up to the gum line, but not going back and forth. I have patients that even tell me, oh no, I use an electric toothbrush and I scrub. And I'm like, oh my goodness, okay, let's talk about this. So you have to kind of just stop and think about those electric toothbrushes. They're not a mandatory, okay? But I will say, as this slide says right now, and the next concept we're gonna go to, if it is fun for your child to use a battery operated toothbrush because it's moving and that just makes it more fun, then by all means, I'm fine with them using that battery operated toothbrush. But let me put the disclaimer on there. Those battery operated toothbrushes are almost one size fits all. There's not a lot of choices in heads. There's not a lot of choices for the heads. And there's electric toothbrushes for kids now. They didn't used to be, but there is now. And the head is a little smaller. It's definitely smaller than the adult's bristle. But again, it may not be the right size for your child. So look at that, okay? So, okay, we learned how to brush. We've learned what type of brushes. We've learned the toothpaste. Now what do we got to do? Well, we got to get our kids engaged. We got to get them engaged in this process. So what we said earlier about be a role model parent, be a role model. Well, brushing can be a family activity. Everybody get their toothbrush, or mom or dad get their toothbrush, older sibling, and we're going to brush. We're going to go in there and we're going to brush our teeth. We're going to do what we're supposed to be doing. You see up here, let me give you some tips and tricks. Every parent knows their child best, right? So I give multiple ideas, and then I let the parents choose which one they think will resonate with their child, what they think will get their child going, or what several things might help, okay? So you see on the picture on the upper left, those are sand timers. What did I say? We need to brush for 2 minutes. A lot of these sand timers are 1-minute timers. There are some 2-minute timers, but if it is a 1-minute timer, which is, I think, a little more fun for the kids anyway, you tell them, okay, you flip the sand over, and you're going to watch that sand come down. You brush your top teeth the whole time until that sand lets out. And then we're going to flip it back over. We're going to start brushing the bottom teeth until all that sand is gone. Okay. That's one way to do it. You'll see on the left side, there's a toothbrush and a tennis ball. There's a toothbrush and a bicycle handle. What? There's a toothbrush through, believe that's supposed to be a dog toy in the yellow rounded circle one, potentially. But I do know the little boy on the lower right has that orange. That is a dog. It is a dog bone, a dog chewing thing. Those are all examples of to make it fun. Make it fun. It could be a regular toothbrush. You just cut a little slit in the top of a tennis ball, a little slit in the bottom, and you push that brush through. And all of a sudden they have this big ball to hold on to, and they're like, cool. Kids like bicycle handles, different things that you think you could do. I will say this makes it fun for the little kids, and they can still move. They can still do the angle and go in circles, right? But the other thing is, what about our kids or adults with dexterity issues? A bigger item, if this is, my hand's a ball, if my hand can go around that ball, great. What if I have arthritis and my hands can only do this? Am I going to be able to hold that thin toothbrush? No. But if it had a ball around it, oh, now my hand can do what it needs to do. So kids with developmental issues, developmental disabilities, sometimes these big handled or putting something on there, it may not necessarily be because of you want to make it fun. It may be out of necessity to be able to allow that child to have some dexterity. Like some of our cerebral palsy patients or Down syndrome patients, sometimes their hands just need that extra help. So I will say another thing that I think is really fun with brushing to get the kids motivated to brush is music. Don't we all like music? Everyone loves music. And even toddlers start moving when they feel the beat. They feel the beat. It could be a kid's Little Mermaid song, or it could be a little country song, rock and roll, whatever you listen to. Most songs are 2 to 3 minutes. So put a song on. Okay, family, let's get our toothpaste on, and we're gonna brush until the song ends. That's a fun thing to do also. Another thing is buying books. Starting the child, you can buy from a child's book where you're reading to them anyway. Why not read about brush, brush, brush? There are a lot of, and with goodness gracious, with Amazon, you can pretty much get anything on the internet now. There's a lot of great multi-language even books for children that you can start reading. That will set them up for not only to be a great patient, to be motivated to brush their teeth, but to understand maybe what it's like to go to the dentist as well. So these are all just some of the things. I'm going to show you a next picture here that is very helpful to do too. We'll go to the next slide. Okay, this is a brushing calendar. You can use any calendar you pick up at the grocery store, an office supply, Target, Walmart, whatever. Get a little calendar, or you can print off pages like with calendar, put the month in it. Let your child go pick out stickers. Go to the dollar store, pick out some fun, let them pick out their fun stickers. They pick them out, and then you use the calendar. And if they brush every day, twice a day, for 2 minutes, and they're doing really well at all this, then guess what? They get to put a sticker on that day. And then you as the parent decide if they get a sticker for every day that week, they get something fun in return, right? It doesn't, I never tell a person that they should that the parent has to go buy something, right? It's not about you have to go buy a gift for them. Kids like going to the park. Kids like going out and riding their bike. They want time spent with their parents. Something as simple as that is what we need to do. And please encourage parents to never reward with sugar, candy. That defeats the whole purpose of everything that you're trying to teach them to do to take care of their mouth. So let's don't reward with sugar items, okay? I really like the idea of these things to have them brush. In today's world, we have apps. And guess what? Yes, guys, there are brushing apps out there. There are different kid ideas and stuff like that that you can use to motivate a kid or to get them interested, because unfortunately our 3-year-olds know how to use our phones sometimes better than we do. So even having something like that can encourage and get them excited to do that. All right, well, if we've done everything we can do and we've tried to get them to brush their teeth, we've thought of all these fun activities, don't give up. Try something else. Encourage parents. When parents first thing they say, well, it's just so hard. They just fight me all the time, or da 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 da. Well, maybe it's because they haven't tried different things, and you helping them create some different ideas and concepts will really motivate the parent or get encouraged. Don't take no for an answer, and encourage parents. They wouldn't take no for an answer for other things, right? Why would you say no to them not taking care of their body? You're not going to say, oh, you don't feel like taking a bath today, or you don't feel like taking a bath all week. That's fine. We're not going to say yes to that. We're going to make sure that they bathe, they stay clean. That keeps them to stay healthy. And it's the same with their teeth. Those have to be clean too to keep us healthy. Let's go. Well, we can go back and just one more thing that I kind of wanted to add here is we don't want to take no for an answer, but we want to encourage kids to be a part of their oral health journey, right? So allowing kids to be engaged, getting them involved of their own health, rewarding them when they do the good job, but not punishment when they don't. Let's try to remember that we want to tell parents to please not, I hear it time and time again, and this is why I have to stop and plead with this, is parents tell their kids, if you don't brush your teeth, the dentist is going to have to pull them all out. If you don't brush your teeth, you're not going to this or that. If you don't brush your teeth, they're going to have to give you a shot and clean out the cavity. I bet all of y'all have probably heard that at one time in your lifetime. Well, I hear it all the time as a dentist, and I'll hear it out in the lobby or out in the waiting room. This is why a long time ago, the precedent was set in pediatric dental offices to not allow parents to come back with their kiddo, because the parents would be scolding them. The parents would be telling them stuff that we really didn't want them to say. It disheartened us to hear those things, and it was worse for the child, right? So, and usually kids behave a whole lot better for other people than they do for their own parents, right? They're hopefully on their best behavior when they're not around their parent. And sometimes when their parents are around, they think I can get away with stuff because mama won't make me do it. Daddy won't force me to do that. So please try to encourage parents to keep a positive attitude. I know it's difficult. I know this is one more thing you're adding, mom, to your day, but let's try to make sure we keep this positive. So flossing, oh my gosh, just like there's so many things of toothpaste out there and different brands and types, there are a bunch of different types of floss. I will say you really can't go wrong with most of the floss, the regular containers of floss out there. You'll see in the picture there on the bottom of the containers of floss, those are little floss holders, floss threaders, and they're different handles, different sizes, and some of the kid ones have, the dad on the right is using one of those little floss holders. That holds the floss and it gives you a little bit of a handle, because a lot of people say, "Oh, my hands." Men will say, I can't even get my hands in my mouth, much less the floss. So if it is difficult for someone to floss, or a parent to try to start introducing flossing, I do recommend the floss holders for that reason and that reason alone. If it's difficult to floss with their hands, or it's difficult to get in a child's mouth to floss, then I would recommend using the floss holders. Okay. Floss aids are helpful. They come in different sizes, shapes. Definitely you can ask for them at the dentist office. We usually have samples of a variety of things. Toddlers love fun stuff, colored things, fun things to hold on to. And the floss holders and regular floss can be purchased anywhere, from dollar store, Walmart, grocery stores. You're gonna see floss. Now, floss, we recommend to do that once a day, every day, especially for adults. Once the teeth touch, you'll want to start flossing. In kids, a lot of times their teeth are like this. There's one here, there's space, and then there's another one. So when there's a lot of space in between, actually not brushing every single day with a child, that's why we don't really push it so early, because there's usually a lot of space. However, if the baby teeth do come in and they're right up against each other, or they're overlapping each other, then we definitely want you to start trying to do some flossing. Okay. I'm not as big of a proponent to say you must floss your child's teeth once a day, every day. That is the best standard of care, is to brush once a day, every day. And it gets them used to flossing once those permanent teeth do come in. And we need to make sure we keep those clean. So floss is a string of floss. And people ask me all the time, you'll see here in the pictures, it's still hard. Flossing is very hard to describe from a picture. This is where I'm like, darn, I wish we had that hand-on approach. But the one big thing I am going to teach and try to show you all today is how to hold the floss. That is everybody's downfall. Everybody's downfall. And you're going to see right now why. And I'll answer that question in just a second. This is yarn. I got yarn because it's bigger than the floss and you can see it on the screen better. You should get a nice, doesn't have to be this long, but a nice strand of floss. Okay, we have our fingers here. You want to wrap the floss around your middle fingers, middle. This is what the middle finger is good for, holding floss. You have your index and your thumbs. You leave those free because those are going to be your worker fingers. Your middle fingers are just holding the floss, because you want to be able to manipulate the floss, because you want to pop it in and then you want to hug the tooth. So you're doing a little, kind of like you're hugging the tooth, or you're surrounding the tooth, and you pop it in and you hug and you go up, down, pop out, next side, pop in, hug, up, down, up, down. Oh, we got the tooth on the other side. So now we're going to hug the other direction and go up, down, up, down. Why do I tell you to put it around your middle fingers? Because if you try, which most everybody does, everybody wants to put it around their index fingers. Well, guess what? I got to hold it with my index fingers. Now I can't make it cup the, hug the tooth, because it's my index fingers. So you need to wrap it around your middle fingers, and then you've got your thumbs and your index fingers to move and manipulate the floss how you need to. Pop it in, hug the tooth, up, down, out. Pop it in, hug this tooth, up and down, okay? The thing about it is we have a peak of gums. We have a little peak of gum that comes in between every single tooth. There's two things you're doing when you're flossing. Not only are you popping out any food debris that may be in there, but you're also flossing When you hug and you go down the tooth, you are flossing down below the gum line to help the root. So you do not get gingivitis or periodontal disease. Periodontal disease is when the gingivitis, the inflammation of the gums, has stayed that way for too long, and now now you're starting to lose bone support. That's what periodontal disease is, when you start losing bone support around the teeth. So the really takeaway with a floss is making sure you wrap it around your middle fingers, leaving your index and your middle fingers free to manipulate. All right, we got a question here. Great question. Do we floss before or after brushing? Guess what, guys? There's no right or wrong answer to that. It is very patient related. If the patient feels better to floss before or floss after brushing, that's perfectly fine. My answer to this, and what I request of my patients when I'm talking to people, is, and I think this is an eye-opener, I tell people, brush your teeth, 2 minutes, do your normal brushing routine, clean everything really well, swish with water and spit out the toothpaste. Now get your floss, wrap it around your middle finger, do the flossing technique I just taught you. When they pop that out and stuff comes out, guess what they've learned from that? Just brushing alone doesn't clean my teeth. Just brushing my teeth alone did not take care of my whole tooth. Because when you pop that floss in and food or something comes out, you're like, oh, okay, I do need to floss. Wow, I just brushed. I brushed for 2 minutes. I did a really good job, I thought, and they still find stuff coming out. So for at least the beginning part of starting to floss, I say floss after brushing, because it's an eye opener for most people. They really realize, wow, I didn't get it all. Was there another question on there, Miss Stacy? Okay, good. All right, well, I am going to stop here for just a second and let Elaine talk about this fun activity that we usually try to show y'all or give ideas on for teaching moments.
Thank you, Dr. Fuqua. All right, guys. So like Dr. Fuqua said, we normally do an activity here where we try to teach you some fun ways to do flossing. But in lieu of that, I'm just going to ask you all the question. What are some ideas that you all have for making flossing fun? We've all heard of the floss dance, right? How many of you use the floss dance? Anybody? I have to be honest. I'm still learning how to do the floss dance. So I think the description Dr. Fuqua just gave on how to floss, for me, is way easier than the floss dance. How about anybody else? Can y'all unmute? I need feedback. I need your ideas. There's some others here. The egg cartons. How many of you have used egg cartons or ice trays?
I haven't tried any of that.
Oh, okay. So these are some ideas for y'all to use then.
Yes.
Awesome. Anybody else? What about cutting the paper plate in half and making a smile and then snipping the edges so they look more like teeth?
I too haven't tried it, but I would be willing to try it.
Okay, very good. And Brenda can probably speak more to this when the jump rope is floss. Brenda, you want to share it?
I'm sorry. So the one that I do with little ones, whenever I was interacting with them and with the parents, to get them excited about flossing, is I got a ribbon, a colorful ribbon, and I lined up the little kids as a mouth, as little teeth, and I had each one floss. And so that's why we would emphasize on hugging each tooth, and then they would see, okay, well, this side wasn't clean, and so now we have to hug the other tooth. And so I would have the kids also participate in that, the parents, so that they could interact in flossing.
That sounds fun.
Mm-hmm.
And very interactive and colorful, sounds like too. I love it. Another one, the one that we actually use in the training is where you put your hands together like you're praying and then you open it. And I know some examples out there spread peanut butter in between your fingers and then let the kids use the yarn or the floss to floss that out. But we just use the floss to floss in between and let people practice that way. And those are great ideas to use in Legos are a good one that people use as well because you can use the Legos, the egg cartons, and the ice trays to practice brushing or flossing or both. And they can be used in sensory as well.
I
Other
think
thoughts?
that wrapping around the middle finger is huge for me. And I mean, I've gone to the dentist religiously my whole life, and no one's ever said that.
Oh, wow.
Yes.
Wow.
I hear that all too often. So thank you for expressing that it is important. And I think it's everyone's downfall. Really, every time I mention it, people are like, oh my God, it is so much easier. So thank you for sharing.
It's also kind of like, oh, why didn't I think of that?
Well,
I flossed every day too, but for the life of me, I couldn't get it that way, so I just used the handle, so makes it easy on me because I couldn't
yeah.
get it, you know. I could never get it right. So I'm gonna try the way you said, Dr. Fuqua, see if it works for me, but I could never get it to work.
And
And
there are adults that actually use the kid flossers because they find them easier to use.
and one thing that I do with like teenagers is I tell them middle fingers are not always bad. They get a kick out of it too whenever I introduce flossing.
Yeah. Well, Claire, that may work for boys for sure.
I'm
Without
gonna
mentioning.
try it.
Right, right.
All right, guys, we have a break that comes up after dental visits. Would you like to continue on through that section or go ahead and take a break now? Because I'm thinking we've been going a while and you might want to take a quick break. Are y'all good with that?
I'm good with whatever.
Okay. Um, then let's just take a quick 5-minute break now, and then we'll come back and pick up with dental visits. Okay?
Okay.
All right.
Okay, sounds
Thank
good.
you.
Elaine, are you there?
Yep, we're getting things started. Hope
I got a
everyone's
quick
back.
I got a quick question before everybody comes back.
Sure.
Um, I've noticed that you guys have not mentioned anything about mouthwash. Is it when
We're
do
giving,
you use it if you ever use that? Like, do you use it before you brush or after you brush or just like the flossing? When do you use that?
well, it depends on what it is. Depending on what kind of rinse you're using. There is some stuff out there like with Listerine that's a pre-rinse
Hmm.
that's supposed to help soften the plaque into easier to get off.
Okay.
And then there's Listerine to help with gingivitis, helps
Hmm.
decrease the growth of the bacteria. It's different bacteria that
Hmm.
causes gingivitis or periodontal disease
Hmm.
from a different bacteria that causes cavities. And there's fluoride, and we're going to mention fluoride here in a little bit
Okay.
about when to use it. And fluoride should always be used after brushing the teeth. And
Okay.
it's best to use it at night before going to bed.
Okay.
Yeah, great question.
Okay. Thank you.
Mhm. All right, so Elaine had just to let everyone know uh, that she had some difficulties. Her computer actually froze right after that, so um, she switched computers over. So we're trying to get her back on with the on the computer. So hang tight.
Okay, I'm back.
Okay, good.
Thank you, Dr. Fuqua. So welcome back, everybody. What we are going to do is continue on, but before we continue with Dr. Fuqua, I wanted to encourage everyone to drop your questions in the question box. We want to get that. We want to know what's concerning you, and we want to be able to have enough time to do that. And also, if you want to just unmute yourself, we'll see that you're unmuted, and then you can ask a question. Dr. Fuqua will call on you, and or I'll say something, but probably Dr. Fuqua will see you, and you'll be able to. She'll call on you to ask your question. Okay. Thank you. Back to you, Dr. Fuqua.
All right, thanks, Elaine. And besides that, I am willing to stay on the line again, like I did yesterday, until everybody's gone. So after the session and people get off, I'm happy to still continue to stay on to answer any other questions for you guys or get clarification on anything. So, goodness, we've talked about a lot of stuff. The right way to brush, all the good stuff about brushing, flossing, how to, why, all that good stuff. But one thing that never gets talked about enough is how oral health can impact your overall health, and also how your medical health can impact your oral health. This means medications. Saliva is so important, like I spoke about yesterday. Saliva is so important to kind of wash out your mouth, keep things lubricated so you can swallow your food. It also helps keep the balance of the pH in your mouth to not be so acidic. Saliva is so important, but what do some medications do? They decrease our saliva. So patients who are on certain medications or on chemo or radiation, anything like that, anything that can decrease the saliva flow, that automatically puts you at higher risk for cavities. So we always want to look at the medications. We want to talk with our physician, talk with our dentist. This is why dentists get medical histories. Patients don't understand why we need to know everything that every medication you're taking. We need to know that because we'll understand or help you to help prevent things from happening in your mouth. One of the medications that most people never consider and don't think about is inhalers. And unfortunately, we have a lot of children out there with asthma. And what they do, these breathing treatments or nebulizers, they do that treatment before they go to bed. or they put in their spacer and their inhaler and they take that. And then after they do that, the very next thing they go to bed. So unfortunately, they're brushing their teeth before the medication. Please make sure, especially for nighttime medications, make sure that you give your child's medication to them, then they go brush their teeth. Very, very important, even with inhalers. I have seen kids that have not had cavities, nothing. I mean, super clean teeth, and then all of a sudden they come in for their next 6-month checkup, and I start noticing 2 or 3 cavities, and I'm like, in 6 months. I'm like, okay, mom, what changed? We start talking about it, and what happens is we find out they were diagnosed with asthma, started on breathing treatments. So very important to brush your teeth after medications, or and especially you think about kids, most medications they take is liquidy, just like you see on that picture to the right. So what does that do? They put sweeteners in there to get the kid to drink it. Still doesn't taste very good, but it's liquid so they can swallow it, and that just pools and sits around their teeth. So please, please, please make sure that medications are taken into consideration, and at nighttime, they take all their medications, then they brush their teeth, then they go to bed, okay? Next slide. All right, I wanna touch real base real quickly. I have a whole half-day seminar on this about oral health care for children with special needs. There's so many things to consider with this, but because the fact that they even have a special need, then oral health is no stranger to being maybe an issue that we need to talk about. What happens with brushing? All the angulation, everything we talked about. Kids with special needs have higher sensory issues, much elevated sensory issues, lots of textures, the feel, the sounds, bother, the smells, bother kiddos. It can bother any kiddo, but you definitely want to take a little more time to consider helping this child, preparing this child for dental visits, brushing the teeth, helping support them. Tell, show, do. That is one of our favorite things to say in dentistry. You tell or explain a patient about what they're going to do. Then you show them what you're going to do, and then you do it. Hence the behavior tell, show, do. I was trying to combine those. We definitely want to make sure that we're communicating with them on their level too. I'm not in person with you, so I can't show this, but I will say kids are much more receptive to what we're telling them if we're down at their level. I mean, I kneel and get down and talk with them. I encourage parents when they bring a child, their kids like running down the hallway in my dental office, and I'm like, let them. They pop their head into something, look at a patient somewhere, you know. I'm like, let them, mom. Oh, they start touching everything. I'm like, let them. Because then they're going to feel more comfortable when they come back and see us. So just getting a patient acclimated to the environment of a dental, y'all got to remember, there's a lot of gadgets in a dental office. Just think, there's a big chair, there's this bright light, there's these mirrors and tools and things that are going in my mouth. There's these things that they don't know their drill because I call them Mr. Whistle, but there's so much in a dental office and in that treatment room. It's you know, it's overwhelming for adults to see. So we definitely want to encourage and teach and help. And like I said earlier with the toothbrush or using the bone, as you see there in the picture, again, they may have dexterity or other kind of problems. So you want to make sure that you consider those. Now, I'm going to tell a little story on my daughter real fast as we go in here to cost and what this looks like. But my own second child was not a favorite of brushing, did not want to do it. Every parent knows their child, what sets them off, what helps them cope, what helps them get through things. And my case, I knew my daughter loved TV. As long as that TV monitor was on and she was watching cartoon, she was frozen. I mean, and I'd say open. We do not have to do brushing only at a sink in a bathroom. We do not. especially if you're not getting a kid engaged with all those great ideas I just said. None of those are working, like in the case of my child. I turned on the TV and she just became an instant. I'd say open and she'd, okay, spit. I mean, she would just stare at that TV, and I would take a cup with water and an empty cup. I would have her spit in the empty cup and rinse the water and spit that water out in the empty cup. So guys, don't take no for an answer. Be creative. Encourage these parents. Life is stressful without making brushing stressful, right? Let's make it fun. Let's encourage, and it's so important for their overall health. Now, we can't get away with talking about dental care without talking about the cost. We all know that dental care is expensive. Dental insurance is not truly even insurance. It's a supplement. When you think about your medical insurance and how that's covered, dental is totally different. It's just a supplement. I hate that they gave it a name insurance because it is not truly insurance. It's a supplement. But I will tell you, everything that we've talked about prevention so far as of now, all that will help prevent the cost of that dentistry, because dental insurance will cover checkups and cleanings, right? But when you get a child that's so severe and they're requiring dental care in an operating room setting, well, guess what you're doing there? You're paying the pediatric dentist to go to the hospital. You're paying for all the procedures they're having to do at the hospital. Oh, you got to pay for the OR room. So now your medical insurance is kicking in. Oh, and we have to pay for the anesthesiologist. And if any kind of pathology happens, then you got to pay for the pathology, the lab report. Well, you all know that is much more expensive than treating a child preventatively or taking care of a cavity that started from that 6 months ago when they saw the dentist and didn't have any cavities, and now they do. It's so much cheaper to take care of that one little small thing than to let things get so bad or so severe that we're exploding the cost of dental care. So like Elaine had there on the bullet tip, you know, it is really truly prevention is so much cheaper than actually paying for the actual treatment itself. All right, ins and outs of a dental visit. I think I saw a question come up though, before I go off onto the, so asking about trauma, or what do you do after a patient has had a bad dental experience, especially, you know, a child? I will say that is my favorite thing to say is I would much rather treat children than adults. And people look at me like, really? Kids are little wiggly woggly worms. Well, guess what? If I'm their first dental experience and I make it positive, I'm going to set them up to be a great dental patient as they grow older. But once a child has had a bad dental experience and now they won't go back, parents not going to fight them. Now they're getting older and now they're an adult, and I can't get through the mind that has been traumatized. So we always want to make sure that we're if the parent says that they had a bad time, they had what? Well, mom, you know what? Maybe it was just that office or how things happened. Let's help you get connected with another office, and let's see if that dental visit, and make sure that we're seeing a dentist, which we're going to talk about in just a minute or two, about the importance of finding the appropriate dentist for you. We're about to go over that. Okay, so I'm going to hold off on the full answer to that. The ins and out of visiting the dentist is the fact that we want to prep the kid. So we talked about books, right? We talked about books. We talked about show, do, tell. Talking to the patient and explaining to parents to not share maybe their bad experience with the dentist, and making sure that they're not threatening the child to behave by saying the dentist is going to do something bad. That sets a child up for a bad dental visit, right? So encouraging the parent to use positive attitude and to really help them prepare before they get to the dentist. So when do we go to the first dentist? When will we go to our first appointment? When the child turns 1 or 6 months of age, or in between 6 months and 1, If the parent feels there's a concern, sees anything on their teeth, a dark spot, anything like that, then we want to emphasize that a child should be seen sooner than age 1 if mom or dad are concerned about anything. But by age 1, they need to be seeing a dentist. Age 1 is the big key thing, because by age 1 they need to see the dentist. By age 1 they're getting other medical vaccinations and stuff like that. And by age 1 we want them off the bottle. So very important age to remember, because those are things we want them to do. And once they've seen the dentist, they need to be going twice a year for checkups and cleanings. Even if a child doesn't need much, the parent says they've got 2 teeth in their mouth. Why do I have to take them for a dentist? Well, guess what? Those first dental appointments early on not only helps us to set that child up for being a great dental patient, having fun, show, do, tell, but you're also educating the parent on all this stuff I've been talking about. The dentist can go over this stuff. The office can talk. The parent can ask questions. So we encourage that even though they may only have 1 or 2 or 3 teeth, they still need to see a dentist by age 1. So how to choose a dentist. This is what I kind of said we're going to talk about. The most important thing that I can say to allow parents to choose a dentist is to actually look at, maybe if they already know their child's a little fearful, then you might want to encourage them to really seek out a pediatric dentist, because they specialize in just kiddos, just seeing baby teeth, helping them get coping skills, helping them get through those appointments. So maybe looking for a pediatric dentist might help that child. And there could be 4 children in a household, and 3 of them have no problem going to a general dentist. They go, the parents go, everyone goes to this dentist. But this one kid in the family, the 3rd one, the 4th one, whatever it is, they're the ones that have a hard time. It's okay. They need to go where they can go to make sure that their child is set up to not only be a great dental patient, but to prevent other things from happening. Because if they're fearful and they don't go, then that child may have problems. Also, pediatric dentists are really versed in the natural growth of a child, right? Because that's all they do, just like a pediatrician. Most parents are not going to take their 1-year-old to a general practitioner. They're going to take them to a pediatrician, right? So no different sometimes in looking at a pediatric dentist versus a general dentist. But I will say, guys, I'm a general dentist, and I have the passion and love the kiddos. I have more fun with them than I do my adult patients. So no offense, but I love the little kiddos. They're so much more fun, and I love to be the positive influence on them as they grow, and get their permanent teeth and all that good stuff. So things that I would like you all to encourage when you're talking with families is to empower them to ask questions. Take a list, maybe. When you're calling to set up the appointment, ask the parent or ask the person that they're talking to on the phone. Let them know that your child maybe had a bad experience at another dental practice, and you want to know, do they do this? Do they do that? You probably want to ask, do they strap down a child? If they say yes, you probably don't want to take your child there. Just because that means they're not taking the time to try to encourage that child to be able to get through the appointment. Is the dentist, if it's a general dentist, are they interested in treating children? Do they treat a lot of children? Do they take Medicaid? Do they take CHIP? Those same kinds of things that you would ask from the medical side, you need to encourage and ask the parent to be involved. I will say I hear it all the time, more times than I care to, that a child had a bad experience at a previous dentist. And I encourage mom or dad to give us a chance. Give us a chance to get that child to have a great visit, and we'll go from there. And sometimes, yes, we have to provide a little bit of oral sedation or the nitrous mask, the laughing gas, to help that child to get through that. But 9 times out of 10, they're going to get through it, because not only do children forget things, they remember a lot. So once you give them that really great positive experience, then that's what they're going to remember, and they're going to forget about the bad experience. So try to remember that with kids. That does happen. Now, I said, let's prepare the kids for a dental visit, right? Well, how do we do that? The best way to do that is to do what we call a two-person position. As you see in the pictures here, this is a mom and dad. At the top picture, it's a mom and dad practicing, showing the kiddo. The wonderful thing about this is the kid can see the parent. The kid feels safe in their knees. Think about the big, long dental chair. Kids are going to look like a little bitty munchkin in that. They just don't fit in our dental chairs. So doing the knee to knee is exactly how we will do a first dental visit with a child, because they're so little. They're age 1. We're going to see them for age 1 for after their birthday for their appointment. So we want to make sure, you'll see the bottom picture, it's the dentist with a parent doing a knee to knee. So just think, if you do this at home and you're learning and helping your child to brush their teeth, as you can notice, the mom on the top is brushing the child's teeth. This will help not only to allow you, both parents, to be involved with things, but then you're setting up that child to what's going to happen at the dental office. Oh, they're going to do this. So child's not going to freak out when they get there and they're doing their, I'm laying down in this position. I know they're 1, but let me tell you, we got to make sure that we're taking the time to help and show them. So let's talk about ways that children can receive fluoride. There's 2 ways. Systemic, meaning throughout your body, which means you're drinking it, you're taking it in. Now, a long time ago, if any of you grew up in the day and age of having fluoride drops, or you had a fluoride prescription from the pediatrician, those things still occur, especially in rural areas, or people who live on well water. They will be given prescriptions for fluoride. So they can have fluoride drops or fluoride liquid or whatever. That's systemic. The beauty of getting the water and the fluoride systemically early on is, what did I talk about? Baby teeth. If mom drinks enough water while the baby's in utero, then they're going to have a better chance of getting that fluoride, and those baby teeth will develop a little stronger. After the baby's born and now they're developing permanent teeth, when they start drinking water, guess what's going to happen? That fluoride that they're getting systemically, that they're swallowing, will help the enamel on the permanent teeth to develop in a stronger format. So it's like vitamins. You take the vitamins, it goes in your body, it does that strong thing for you. It's the same with the fluoride. It's so important. And that's why we still to this day push for fluoride in water, because you get it systemically and it helps develop those teeth when they're growing and they're developing, okay? The other way is getting it topically, okay? So once the teeth are out, they're here, they're already developed, then that's when we want to use fluoridated toothpaste, and or we want to, want to use a fluoride rinse, like you see the bottle there with the Act fluoride. So this is giving them a little more than what's on just in their toothpaste. So once a child can swish and spit without swallowing, I always tell a parent, practice with water first. If your child can swish, I always tell, let me see you make bubbles. If the child can do that with water and not, you don't see them stop the bubble banking and swallow and they spit out the water, then they're ready to go on to fluoride. And the fluoride rinse should be used at night before going to bed. You brush, you floss, you do your nightly routine. After taking maybe any medication, that's when you brush, floss, do all that good stuff. You rinse with water, spit it all out, and then you put a little bit of this fluoride in your mouth and swish with it for about 20, 30 seconds, and then spit it out and go to bed. Don't drink any more water, don't eat anything, do nothing. That Fluoride needs to sit on the teeth all night long while you're sleeping when there's no saliva flow. That is the best time to use the fluoride. The last picture on the very lower right, you see it looks like a little paintbrush on the teeth. That's fluoride varnish. That is pretty much what we have mainly gone to in dentistry now, is the fluoride varnish after we professionally clean a patient's teeth. We put a fluoride varnish, and we even use it on adults. It's not just for children. It produces a thin coated layer that protects the teeth. And it's a stronger type of fluoride. So we really use the fluoride varnish more than we are the foams or the rinses in the dental office. So I'm not going to get into the politics of the fluoride, right? I'm not going to say should or would or what, but the reason we continue as dentists and in dentistry, you just heard why we still advocate for it to be in the water. I'm not going to get in the pros and the cons of all of that, or start a political kind of information thing going here. But here is a website that you can go to get more information from the American Academy of Pediatrics, and there's information from the American Academy of Pediatric Dentistry as well. Those are the two great sources to go to see the importance or get more information on fluoride. And for you all, if you notice when tell your parents you get your water bill, right? You get your water bill at home. They're supposed to annually or biannually send you a report about the fluoride that's in the water in your town where you live. So another good thing to look at. All right, sealants. I hope that all of you have maybe heard this word of sealant. It's a plastic protective coating that goes into those darn grooves that all the bacteria likes to hide in and our food gets stuck in. When a permanent tooth comes in, permanent molar in the back, a sealant is placed by the dentist or the dental hygienist. And this sealant will seal off those grooves so food can't get stuck in there, bacteria can't hide in there. But I do want to say, sealants are great. They'll last for a good long time. But if a kid is always eating ice or chewing on really hard stuff or really sticky stuff, those sealants can be popped out. And that's not the end of the world. It just means that their next checkup and cleaning, when they're seen, they may have to redo the sealant, okay? But we do try to encourage families to not be letting the child eat really sticky stuff. So we showed you all the stuff yesterday about the process of getting a cavity, but I want to show and give you information on how to avoid getting the cavities and maybe some things to look at. So right here you see a picture and you see all these little arrows pointing to white areas, okay? Those little white chalky looking spots. Now that white spots can be a precursor to the start of a cavity. What happens is when enamel starts breaking down, the first thing that happens is it becomes demineralized. So the enamel becomes weaker, okay? If the bacteria and you don't keep that area clean, it will progress on to then become a darker spot or a hole, black hole, as the cavity progresses on the tooth. So white spots, if parents see white spots or any kind of funny coloring to their teeth, they should get their child to a dentist. So say they're 9 months old and say, oh, I noticed it. Say, then you might want to get your child to the dentist so they can look at that and make sure there's not any problems or see what they maybe need to do for your child. But white spots can not only be precursors, but also could be another problem. So I'm not going to go into what all the other things it could be, but white spots, definitely get them to a dentist because that's typically the beginning stage of a cavity. We talked about baby bottle tooth decay, early childhood caries. This is kind of as you go across from upper left to upper right to lower left to lower right. This kind of shows a progression, okay, of a cavity and how it starts breaking down the enamel and how that bacteria, that Streptococcus mutans we talked about, that bacteria starts eating away at the enamel and causes this to happen. And again, remember, This occurs, baby bottle tooth decay, early childhood caries, when baby teeth come in, they've drank milk or they're sucking through the bottle and they fall asleep and that milk just sits held between their lip and their teeth. Next slide, Stacy. I want to say one of the biggest things we need to do is ask parents. I love when Elaine kind of started talking about this and developed this little brochure, and it's called Lift the Lip. I can't tell you how many times parents, they don't even know what's going on in their child's mouth. They don't even know they have a cavity. And I'll be like, well, okay, let's look in here. Do you see this dark black spot? And they're like, oh yeah. Well, it's not that they didn't tell that there was a problem or couldn't understand that there was a problem. They just weren't looking in their child's mouth. So really encouraging the parents to let their child brush their teeth themselves. Then you as the parent, you try to brush and finish it for them to make sure they're doing a good job. And while you're doing that, lift up their lips and cheeks and look around, okay? We need to make sure that our parents are aware of what's going in their child's mouth. Look for those white spots, that early sign, because if those early signs of a cavity starts with a white spot, we can do something that's called arrest the cavities, meaning stop it from being active by cleaning it properly, keeping it clean, keeping enough fluoride to it. The white spots already occurred. That's not going to change. It's going to stay a white spot. But if you keep it clean, it won't progress onto a full-blown cavity requiring a filling or something more. Let's talk, I want to go real quick through this because I think Elaine has a really good activity. I already told we want kids off of the bottle by age 1. That's really hard to do, but let's be converting from a baby bottle to a sippy cup. And we want to make sure that we're not putting juice. You see that lower left picture with the red. Children should not, babies should not be drinking juice anyway until after age 1. Juice is like Dr. Gold says here, pediatric dentist that helps us out quite a bit. This is her quote, is when it comes to dental health, juice is like soda to a baby. So there is a lot of sugar in juice, and apple juice has natural sugars in there. Let's go to the next slide because I want to talk about getting the child off the bottle. If we're going to give them a bottle, we say only water. If your child needs to suck on a bottle to fall asleep, then you need to be putting just water in it. If they're age 1 and you're trying to get them off the bottle, we need to get them to water. It may be hard to do if the parents already started with something. So my thing to do here is, you've got the picture from left to right as we're looking at the progression. Dilute juices. If a parent has already introduced a kid to juice before the age 1, which causes diarrhea for children, that's why we don't want kids on any juice before age 1. But after age 1, it may not mess with their intestinal tract as much at that age, but it's full of sugar, natural sugars from apple juice. The juice is a natural, even though, and people think it's apple juice, it's apples. Apples are good for you. It's not, it's full of natural sugars. So when you look to the left, to the right, if you've already introduced full apple juice, start diluting that. Make 4 ounces of apple juice, 2 ounces of water, 3 ounces for a whole week, and then take it down, to less apple juice to more water, and then very little apple juice to more water, and then you're all the way to pure water, okay? If a kid doesn't like the way that tastes, they're not going to drink it, and you as a parent are not giving them anything else. If they don't drink this, they don't get anything, right? We've got to make sure that we're setting up those right decisions early on. And I try to tell parents, guess what? You're the one that buys all this stuff. If you don't introduce it to them early, then they'll never know what they're missing out on. If they only drink water like my child did, and at age 3, I went and got a little Happy Meal for her, not even thinking, for her first Happy Meal. She was 3, and the apple juice box came with it from McDonald's. And she drank it. She's like, oh, mommy, it tastes bad. And she gave me that, and it dawned on me why it tasted bad to her. because I'd never given her apple juice. And I had put some juice in some water to kind of flavor it, but she was drinking pretty much a little bit of colored water. And that apple juice was full blown, full strength. So make sure that we start kids out early on the right track, because they don't know what they're missing if you don't ever introduce it. And I will tell you, I cannot tell how many times a parent comes in with a bottle or a sippy cup and it's got soda in it. That's just not good for children at all. So I'm going to stop here and let Elaine, were you going to take her? I think I was going to talk about this first a little bit. Sorry, I'm trying to get through this fast and get us off somewhat on time. The nutritional part of what we eat and drink makes a huge difference. There is a emphasis on nutrition, not only for your body health, but for your dental health, because it affects both. So this idea that came up of let's do a go slow, whoa kind of thing. This is resonates really well with children, to teach them like green light, go, yellow light, ooh, we maybe need to slow down, and red light, whoa, we need to stop. Okay. So this is a fun way to talk to children about maybe what is good to eat, what's good to snack on. I already talked about apple juice, people thinking apple juice is apple, so it's great. But it's not. Eating an actual apple would be much healthier, okay? Let's work. Lane's got a lot of great examples, but let's go to the next, and I'm just gonna quickly look at this. Look at this slide. So the regular red apple on the lower right would be a go food. It's fruit. We need to have so many servings of fruits and vegetables every day. All of us do. That would be the best way to get your fruit intake, is the natural apple. What would be our slow thing? Well, it'd be the applesauce. That would be kind of like, oh, it's good, but it's got a little sugar in it. It actually has the natural and more sugar. And what would be the completely red, let's stop, it's a fried apple pie. We definitely, though that looks really good and tasty, and I tell children all the time, and parents, I'm not saying don't ever give this. Heck, I love sweets just as anyone else does. But we don't want to be eating that every day and all the time. So let's go over some examples to make you think about what we can do to help families realize the good and the bad with what we eat. So I'm now turning it over officially to Elaine.
All right, sorry. Ooh,
Are you ready? We can
yep.
hear you.
Okay, there was just some feedback that sounded really weird. Okay, guys, sorry about that. Stacy, if you will click. So this is just us. So as you look at those, tell me, what do you think baked chips, where do they fall? Can you unmute yourselves? Baked chips, is that a go slow or a whoa food item?
Slow?
It is,
Whoa.
it's a
Whoa.
slow. It is a slow. What
Oh,
about canned peaches and heavy syrup?
I would say
A
row.
slow?
Whoa.
It's actually a whoa, and it's because of the word syrup
The
that
heavy
you can,
syrup?
it's the heavy syrup that makes that a whoa. What about a fresh apple slice? I think you know the answer to that.
Go.
Go.
Yes, it's a go. What about low-fat cheese?
Go?
Yes, it is a go because it's low-fat cheese. What about a biscuit?
Slow.
Whoa.
Whoa.
A biscuit would be a slow.
Mm.
Ooh.
What about a
Oh, I
donut?
see. That's a
Whoa.
A whoa.
It's
whoa.
slow.
Oh, well,
No,
it is a
whoa.
whoa. It is a whoa, but sometimes it's a go because you just got to have a donut, right?
Yep.
Gotta go get one. So now that you've had an example, we're gonna just play this quick little game, guys, and I do want your input. I mean, I want you to participate, but we're gonna go through a few of these kind of quickly so we can get towards the end here because we want, like Dr. Fuquay said, we want to respect your time. But just know this game is a fun game that you can do with the parents and kids, probably older kids, but it would be a fun game. And there's some exercises that you're able to tie to Go Slow and Whoa to show the motion and the movement with the energy you're getting from the foods you eat type of thing. And Dr. Fuquay did share with the types of food. So when you look at Go Slow and Whoa, would you call that a slow or a go or a whoa?
Slow?
Whoa.
I'd
think-
say whoa.
Well,
Whoa.
I think it's a combination of three.
Well, it's a
Mm.
whoa. Stacey, can you go back for just a second? It is a whoa food. So you can probably guess why it's a whoa because of the jelly and the peanut butter. So how can you make it a slow food? Because you can take a whoa to a slow, and you can even take a go down to a slow. It's all in the preparation of the food. So
Maybe
how could we make this sandwich more of a slow?
if we change the white bread to a wheat bread, and then if we change the sugar-free jello, I don't know if there's such a thing.
Yes. Yep. That's actually good. And what
And
can we do with
then
the peanut butter?
we could change the peanut butter
Natural. Use
to
natural.
a
Low
natural or
fat.
low fat. Yeah.
Yes, because the thing is the less sugar. And these slides are based on low to no sugar and basically low to no fats when we do the Go Slow Whoa. And just because something is maybe good and okay for your body, you have to also remember, is that good for my teeth?
Mm-hmm.
So when you're talking about eating peanut butter, jelly, bread, those things are going to sit right into the crevices of your teeth. So it's not going to be the best eating it alone, but you put an apple with it and it'll help pull the apple crunch will help pull some of that out of your teeth. So what about the meat? What do you trimmed lean beef? Is that a go or a slow or a whoa?
Slow.
well,
Go.
Low.
Y'all are so
It's a
funny.
go.
It is a
Go.
go because it is trimmed beef. Now,
Okay.
how could that beef be a go from a go to a slow?
With a lot of fat.
Oh, fat-free, I think. Like really.
You add
Yes,
you add
the
cheese.
amount of fat that you have in it and how you prepare it, right? So you can even take that same piece of meat and it goes all the way down to a whoa when you put it in a burger because you're frying it.
Mm-hmm.
And
Mm.
so combine that with how much fat is already in that meat. Now
Oh
I'm frying
Lord.
it. Yes, exactly. What
Oh
about a
Lord.
banana split? And
That's
I
a
love
whoa.
whoa,
That's a
y'all
go.
already know,
whoa.
right? So
That's a
don't
whoa.
so don't let the banana fool you. But how could you make that banana split a slow?
Um,
So we
Yogurt
already
ice
know that
cream.
the
Sugar-free
banana,
ice
Sugar ice
yes,
creams.
yes,
Sugar-free ice creams.
yes, that would help.
Just eat
Absolutely.
the banana and then brush your teeth.
Or you could possibly even use yogurt to make
mm-hmm.
your banana
Yes.
split. And
Yeah.
you have to also keep in mind portion size as
Yeah.
well when you think
Mhm.
about your healthy body and in your teeth. Thank you, Stacy.
You can
So
make banana ice cream as well.
yes, you can. Okay, so we have frozen 100% fruit juice bars here. Go slow or whoa.
Slow.
That's a
Whoa.
Slow.
That'd be
slow.
whoa.
It is a
Slow.
slow. It is a
It
slow.
is slow.
100% juice period is in the slow category. So
Mm.
even if you freeze it, it's still slow.
Mm-hmm.
Okay. Um, these chicken wings, how can you okay, go slow or whoa.
Whoa.
If
It's a
they
Well,
do not have
Whoa.
honey on
It's a
them,
so
row.
so it is a whoa, but can you tell me why it's a whoa?
because it doesn't say anything about reduced fat or anything like that, and it's
Right.
just, you know,
And it's
And the
fried,
What
it's
about
just
sauce,
Get
what's
fried.
and
on
the
that
it?
Yeah.
and
skin
it
What
has
off.
the
sauces are
heavy
put on it?
dressings on it. Yes, all of
Mhm.
those. What about the yogurt? Is it
Go.
go? It is goat.
Go.
Very
Okay.
good. Very good. So that was just some quick practice using the Go Slow Whoa. And we actually have Go Slow Whoa cards that you can use to play the game. And guys, so what we're going to talk about is what happens next. Now that you've gone through this training, what happens? We're not trying to turn you into dentists, as Dr. Fuqua said, but I would like to turn you into advocates, not only for children's oral health, but for the oral health of the children and the parents and the families that you serve, right? So as professionals, if you just do nothing but when you are engaged in talking to these families, assess what their oral health needs are. What are their behaviors? What are you seeing? So you've seen enough pictures to kind of to know you can kind of know just by looking and when you're having the conversations if something is going on with their mouth, if they're eating a lot of sweets, what are some of their habits that they've developed as a family. The other approach is with community. What can you do and how can you promote the importance of oral health? And again, you would do that by sharing information. Some of the resources we have are awareness resources with the families. And education is simply talking about oral health. And I call them those oral health moments. When a moment presents itself, talk about oral health. If you have classrooms where you have kids engaged that you're teaching them anyway, add an oral health component to that. And we have resources that we can give you free to help you with all of that. And some of that is we do have the educational toolkit that has lessons in it. It has a lot of our slim cards and a lot of our handouts. Some of the materials that you saw Dr. Fuqua use during the training are in the toolkit. And those are just some additional resources. We have the bifold card, the dental brochure, how much fluoride to use in the fluoride card. And on the next slide, we have what we give out oral health kits. So we have infant kits, toddler kits, and youth kits. All of these items are available to you at no charge. We just ask that you help us get them out in the community. And again, this is the teaching toolkit. What I've done in the past, say, for example, you have an organization like Center for Transforming Lives. And if you have several, like maybe 4 or 5 of your teachers actively engaged in providing oral health education, I will provide you a kit to keep at your facility to keep oral health going. And not only that, when the kids do, we will provide you with some incentives for the kids as well as for you. So when you provide at least 2 lessons to the children or the parents in a group, we will provide you a little mini dental puppet. And these are just some examples of what those look like. And on the next slide, so we wanted to give you an opportunity to ask questions, but what I'm going to do, Stacy, go ahead and go to the next slide. We're going to come back and let y'all ask questions at the end. What I need you all to do is take just a few minutes to use the QR code at the top right-hand corner of the screen or the, hold on, getting ready to drop it in the box for you, or click on the link to complete the evaluation so you can get a certificate. And once you get that certificate, I'm sorry, once you get the evaluation completed, a certificate is generated immediately. So you will be able to get that. You won't get it today when I say immediately, but it'll come, and then it's just a matter of me getting it sent to you. So now you can go back to the well, Stacey, let's just hold that it there for a minute so people have an opportunity to grab the link and the web page. Uh-oh, sis, the web page not found for the link? Huh. Let me see. Okay, here, let me go back. Well, I will send you the link. Okay, I will send you the link after the presentation so you can, if you can't use the QR code or don't want to use the QR code, I will provide the link after the class today and you can go in and try it. Okay. So let's go back to the questions. So if you have questions for Dr. Fuqua or myself, I know we kind of went through that last bit pretty quick, but we wanted to respect your time because you showed up on time and we wanted to be able to let you go. It's Friday, so we wanted to be able to give your time back to you. But please don't hesitate to ask your questions, and I'm available for you with whatever that you have, questions or not. And guys, just know there will be one additional follow-up training, and it's on health literacy. And it's also just an opportunity to touch base and answer any additional questions that you may have now that you've taken this information back and you're working with the parents and the families that you serve. So it will probably be coming up in the next couple of weeks that I'll get that scheduled and sent out to you guys to participate in. So it's only like maybe 30, 45 minutes, so it won't take much of your time. Thank
Elaine,
you.
it looks
Yes,
like
ma'am.
it looks like Nancy Hoon put in the link that is working. So maybe
Okay,
people
perfect.
click on that now, see if that works.
For the, thanks, Nancy. If
For the
that's the one,
survey.
yes, thank you.
No problem. Is your link work, but it's just 2 times? You put in 2 times?
Oh,
Oh, thank you.
that's interesting. Okay. We'll have to make a note of that. So do y'all have any questions for Dr. Fuqua? Any feedback that you'd like to share with us?
I do have a question.
Yes, ma'am.
I know some wonderful dentists in the Denton area, and they are so incredibly busy, and I would love to bring this information to them. Do you have any tips on how to approach them to be respectful of their time and how much time to ask for to be able to relay this information? I would love to hear that from a doctor's point of view, so that it's not intrusive, it's not pushy, etc.
What exactly are you, so that I can understand how to best answer that question, what exactly are you wanting to try to take to them? Like the whole entire training kind of thing, or some highlighted bullet points that you think would be helpful to just share with dentists?
Highlighted bullet points, particularly about children. I know some dentists that are doing some work with children in need, and just how to maybe disperse some of this wonderful education, maybe like to share some of these tidbits with them to pass along.
I wouldn't say, if you had a personal relationship with a dentist or somewhat of a good, I'm not saying personal as you know them, personally, as a friend, but if you have a good working relationship with dentists, and to share that this is out there, we're hoping to have these links out there. And I know dentists who have asked their staff to go through these to help get these, because a lot of dentists are like, I would love to help with kids. I want to help with kids. I really don't feel comfortable. So even though they're a dentist, they're not used to, sometimes general dentists are not, a lot of times they are not used to treating children. It's a different way to talk to them, a different way to approach them, a different way to go about things to make them feel more comfortable. And like Elaine said, with the next kind of thing that we didn't get to really is health literacy. Talking, one of the big things I want to do is always talk to a patient in the words that they can understand. I went to dental school. Saying all my big dental words doesn't mean a heck of anything when I'm talking to someone who has not been to dental school, right? But dentists who don't work with children, they forget to even bring it down further, right? From layman's terms to children's terms. And so not calling the handpiece the drill. We don't use drill. We don't use handpiece. We say it is Mr. Whistle. When we use our air water tip to spray water or air in a patient's mouth, I mean, we call that our squirt gun. Look at this, and I'll show kids the water squirting out of it, and they laugh. The kids will go, get mama with that, and I'll squirt and we'll get mama's foot, you know, and then they, all of a sudden it's fun. In other words, so talking sometimes to general dentists, you have a very good point to say, here is some education, or here's some stuff I went through, and I thought it was really, really great, because we do plan to have this out there eventually here soon. That's why we recorded for the last 2 days, so that this kind of information can be utilized or put on our website for people to go and click on. I will say though that we do have some good tidbits of information that we've put together for our Save a Smile program, because we have over 95 dentists, or around 95 dentists that volunteer in the community to treat children free of charge through our Save a Smile program. And they don't always know what to ask or to do. So we have put together some information for them. That might be something we can share with you. So Elaine, if you'll make sure we jot that down, we'll get that together, and maybe we can email you that stuff.
Appreciate it. Thank you.
Well, you're welcome.
Cassandra, let me ask you a question. Do you all have someone that's from the health plan that specifically works with the dentist in the area? Or medical providers, either one?
You mean in what area?
Well, well, I know that the Denton area, you were specifically asking about Denton. So I didn't know if you had staff that outreach to different medical dental providers.
I know we have a provider relations department. I don't know their outreach to the Denton area. And I don't know how far reaching it goes in terms of dental, but I can check into that.
Okay. Okay. Just curious, because I was going to say that might be an avenue, because with that already contact there, it may be helpful.
Dr. Fuquay, I had a question.
Yes.
So regarding like, you know, kids that have special needs, kids that are maybe a little hesitant on going to the dentist, is it possible for children to maybe visit the dental clinic prior to their actual visit, just to get comfortable with the surroundings, kind of see how it's going, you know, what is expected out of them, just to kind of ease the stress of going to their dental visit?
Ding, 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 bingo. Yes, that is exactly what we would like to see.
Okay.
And that is a question that you can encourage parents to ask. I'll set up my appointment, or I'll set up one of their older kids' appointments or something like that, and bring the littler kid with you to watch. Now, I would not bring a little kid with you if the parent's getting an extraction, but
right.
I would say if they're going in for a checkup and a cleaning, that is part of the tell, show, do. You talk to them about going to the dentist, then you show them what it's like to go to the dentist by them watching someone else in the family getting their checkup and cleaning. And the next thing you know, the kids are excited because it's their turn. They're excited about it. So encourage parents to ask about that. I love for my kids that I'm going to see, even if I haven't seen them yet, as a real patient, but they come along with the parent, I let them run around, check things out. I've had kids want to sit next to me as the dental assistant, and, you know, and I'm like, get them some gloves, and we'll put gloves and masks. And of course, that was all prior COVID kind of thing. But I still, if they're the child to a mama, they live together. It doesn't matter. They don't have masks on with each other, so they still put gloves on. And one thing that I would highly encourage you all to do is another good idea, and something I do in my office all the time, is I give out a dentist kit. What that kit includes is it's a bag with gloves, masks, a disposable mouth mirror, the little plastic mouth mirror, but it's just like the one we use to look in a patient's mouth. And then we give instructions and information in there, maybe some fun things, but that's a dentist kit so that they can go home and put on gloves, put their mask on, and check out mama's teeth, right? They get to play dentist. They get to check out, and they tell mom, wash it really good with soap and water, and then you're the dentist, mom, and they're the patient, like role playing, right? Role playing. So don't ever hesitate to tell a parent that if they've been to the dentist, ask and say, I would like to prepare my child for coming to the dentist for the first time. Is there any way that I can get maybe some gloves or mask or, you know, a disposable mouth mirror so that I can play dentist at home with that child? If a parent was to ask that of a dentist, they're going to be like, well, kudos to you, mom, for thinking that way, right? I wish all dentists thought that way, but they don't necessarily stop to think like that. But encourage parents to do that and to ask.
I love that idea. Thank you.
You're most welcome. I love how you pretty much answered what you were trying to ask about because you hit the nail on the head there with that hotel show do and letting them watch and anticipate. And you know, I had twins in, two little girls, both 5, and one little sister, both of them sit in the chair fine. They were both in 2 different rooms, but the one little sister was very hesitant. The other little sister had a wiggly tooth and she was like, yeah, can you take this out with your tools? So you never know from one kid to another. And I ended up helping her out. All I had to do was twist the tooth out. That baby tooth was just hanging there. When the other little girl looked at it in the mirror, saw her sister, the twin goes, ew, there's a little blood. She goes, I don't want to take a tooth out now. So everyone's different, but Tell Show Do helps them to understand how or what there may be going on.
I usually encourage parents to do so, but I didn't know if I was like bombarding dental clinics with all these pre-visits for kids who may have like anxiety about going. So I just wanted to make sure it was something that was okay to encourage.
Is what you should do, especially if you just said it, anxiety, autism, Down syndrome, some of these developmental, where they're cognitive, they know they have a brain, but they're just not completely, you know, function at a normal level. Kids, period, without no developmental problem are very sensory oriented, like I've said multiple times before, but they're very routine oriented. If you do something over and over again, it sticks with them. No difference with the dental. So if they come in and they see it and they see it and they see it, and keeping them on their routine. When you get them off their routine, chaos happens, right? What happens when you wake up and your alarm hasn't gone off? You just start going, oh my God, you're everywhere. You're things that, and then what do? You forget something, either steps in what you do usually every morning, or you get out of the house without something because you're in a rush and your routine was messed up. Well, we're all creatures of habit.
All right, guys. We're going to need to close out the session, but I will send you, like I said, the link. And if you have any questions, by all means, send them to me and I'll pass them on to Dr. Fuquay, or I can give you, Dr. Fuquay, are you okay with me sharing your email? Okay. I will share Dr. Fuquay's email and you can contact her directly with any of your dental related questions. And thank you again.
Stacy, put the QR code up again. Go back to the.
Thank
I'm
you.
gonna get Stacy to put the QR code up there real quick. Someone just asked that, but
okay,
go ahead.
Thank you. Yes, guys, please take a few minutes to go ahead and get that done. But the QR code won't be included in the email, but the link will when I send it. Yeah. But thank you guys for all your participation and for completing the evaluation. And I hope y'all had a good time. We had fun with you.